Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we'll be going over an exercise that many people do not know but is very important for those with frontal knee pain around the kneecap. If you've already realized that you have a lateral tracking kneecap or patella disorder, this one is important because it addresses the often missed tilted patella postural tendency. Hi everyone, Dr. Remy from Posture Size and Pain Free and Fit. Today we have a great exercise for those of you who have persistent knee pain around the kneecap. Many of you have already learned the patella tracking correction, but there's another situation that happens in the kneecap that many times goes unnoticed and therefore untreated by the best of therapists and doctors and trainers. And that's the condition of a tilting kneecap. And by tilting, the typical scenario that's common for most people, especially with lateral tracking patella disorders, is a kneecap that actually tilts where its inner edge moves more forward than it should be, and its outer edge moves backwards more than it should be. This is again a result of a weak VMO muscle that pins the inside of the kneecap down. Again, that can vary depending on the insertion of that muscle. And an overactive lateral complex with your ITB, iliotibial band, TFL, and vastus lateralis. So many of you have already seen the initial movement of the kneecap being symmetrical as I tense the inner pressure of the kneecap during knee bending and knee straightening. If you haven't yet learned about that, there's a separate video that goes over the patella lateral tracking or kneecap lateral tracking correction. But what I want to do is, if I also have a tilting patella or tilting kneecap, I want to make sure I am exerting a backwards force on the inner edge of the kneecap and a forwards force on the outer edge of the kneecap. Now the only way I'll know that is by feeling the kneecap. So from the same position, if you go to the top, inner and outer edges of your kneecap, as you straighten, you may actually feel the outer edge tilt backwards and the inner edge tilt forwards. So you need to actually almost think this one through. As you're straightening, you want to imagine that kneecap is tilting in. Now you don't want to turn your shin bone or your ankle, just the kneecap itself. You're visualizing that that inner edge starts to move down and back, the outer edge moves forward, particularly the inner edge moving down and back. With more and more practice, you'll begin to notice that that VMO is contracting harder. There'll be more of a tension underneath your inner finger, and there'll be more of a symmetry of that kneecap. Besides being moved in from the lateral position, it will also be moving backwards on the inner position.